So when I think about newborn screening, I really think it starts with when you first learn that you're pregnant and you have to go to the doctors and get your blood work done. And that was whenever I learned that I was a carrier for cystic fibrosis.
Cystic fibrosis is a common genetic condition that can affect the respiratory tract with recurrent respiratory infections. It can also affect the gastrointestinal tract. It can also cause troubles with the salt balance in the body and in the skin.
Once I learned that I was a carrier for cystic fibrosis, the state of Delaware had my husband go to get tested as well to learn if he was a carrier, and he was. We were actually anxious to do the newborn screening so we knew what we were facing. Her results were that she has cystic fibrosis. It was like the weight of the world just came down. But I think what was great about it was that immediately we were hooked up with a team at AI DuPont Children's Hospital, and we were given all the tools and the hope and everything necessary to know that we could move forward and manage her disease.
Delaware's newborn screening program is a critically important public health program. This program is intended to identify rare disorders like sickle cell or cystic fibrosis in babies as early in life as possible. This is important because a baby may appear healthy at birth, but if you don't detect these disorders early on, you may have developmental disorders, serious medical conditions, and even death if we don't get babies into treatment as early as possible. So through the program, babies are identified through confirmatory testing, and then they can get into treatment, which not only improves their outcomes, but it also saves healthcare costs. In Delaware, state law requires that every baby be screened for 47 conditions. We are grateful to our partners at Nemours for the work they do to help babies be healthy. So take a few moments to watch how our partners at Nemours keep this program going.
Typically, screening occurs in the birthing hospitals in the first day or two of life. It's done by taking some blood from an infant's heel, along with doing a hearing exam and checking the oxygen levels in a baby's blood. The results of the hearing testing and the blood oxygen level, parents will get back right away before their baby leaves the hospital. The results of the blood tests are typically available by the time the baby's 5 or 7 days of age, and they can get those results from the pediatricians here in Delaware. The state views newborn screening as one of its most important public health initiatives because it starts to prioritize the baby's health from day one. Delaware has partnered with Nemours AI DuPont Hospital for Children. We have a team of a doctor, a newborn screening manager, and a newborn screening coordinator. And then every baby that had an abnormal newborn screen, we ensure that there's good communication with the primary care doctor, the birthing hospital, any specialist to ensure that the baby gets appropriate follow-up. And we work closely with the state to ensure that we continue to impact the care of every child in Delaware.
I think newborn screening has made a huge difference. It's a great way for families to prepare, get a better assessment, and start treatment early, and also be educated early on how to take care of them if there are different needs related to any of the conditions that show up on newborn screening.
Your baby may have an abnormal newborn screen, and it doesn't necessarily mean they have that condition. They're going to need follow-up testing to prove whether or not they have that condition. We follow every baby's case until they have a diagnosis or until we prove that the newborn screening test was a false positive test. We'd rather err on the side of having a false positive test than having a baby with a disorder that we miss.
I'm grateful to the state of Delaware for having, not only just having newborn screening, but having the level of rigor for their newborn screening that they do. Because I think a lot of the illnesses that Amelia had whenever she was an infant as a result of cystic fibrosis could have been misdiagnosed.
And really, newborn screening for CF has helped to avoid that. Looking at studies that have been published early on, infants who are diagnosed by newborn screening tend to show better weight, height compared to those who are diagnosed before newborn screening was available.
Newborn screening has been one of the most successful public health initiative programs all over the country, and particularly here in Delaware, because there's not a lot of risks to doing newborn screening. Every parent will get a chance to look at the consent form and have an opportunity to read about what happens to their baby's blood spot. And most babies will have a normal newborn screen, but it's a very safe test.
I can understand that families might be worried about the possibility of uncovering an illness in their precious newborn. But I think as medical providers, as members of the care team, as family members, I think all of us really want what's best for a precious new baby.
I think if a parent is hesitant about newborn screening, they should speak with their child's primary care doctor, and they should speak with the nurses in the birthing hospital to help them make a decision that's best for their child.
I almost think of it as you have a choice to be in control of your future and of your care. I prefer to be empowered with the knowledge to be able to make sure that my child is receiving the best care possible. Go ahead, take care of it, and make sure your child is healthy.